Hello, everybody. When this Obamacare debate opened up a few years ago before its implementation, I remember lengthy debates on social media about the pros and cons of this system versus the free market. And I made an interesting discovery. I was on the free market side, and some of my friends were on the pro-government side, and we strenuously opposed each other for precisely the same reason. Both of us want more people to have more access to more affordable and better quality health care. We all agree that we want people to be better. We want people to be taken care of. We don't want somebody to be sick or ill or injured and to be neglected. None of us want that. But the question is, what's the best way to take care of that person? And so by way of analogy, I was thinking, well, what about cell phone service and the way it's improved and become more affordable over the last several years? And just as an example, years ago, 8 or 9 years ago, I started with a no-contract, low-budget cell phone provider, one that I still use and I'm still very happy with because it meets my needs. I don't text a lot, don't talk a lot. I have a mid-range 5-digit income, and so I'm looking for something affordable. And I started off with this phone, which can text and talk and play Tetris, but it can't do much more than that. And so it was what I could afford, and I was happy with it for a while. And then I moved up to the next step. Yes, a flip phone. I mean, I thought growing up in the 60s, if this is good enough for Captain Kirk, it's good enough for me. And so this phone could take pictures, it could take video, and it even had limited internet access. And then I really thought I'd hit the jackpot with my Java phone. And my little Java phone not only did pictures and video and limited internet access, it could run a few apps. I mean, a few of mediocre quality. And then one day, the next level in technology became affordable to me, and I moved up to this Alcatel. Now, I know some of you iPhone users are probably laughing and you have tears streaming down your faces right now, but this phone does what I want. It does text, it does talk, it takes pictures, it does video, it has internet access, and it can run a bunch of apps because it is, after all, on Android, and it works for me. Now, for people that have higher incomes and have a lifestyle that requires a better phone, a smarter phone, a faster phone, one that can do more unlimited text talk data for X number of dollars a month, fine, more power to you. But I'm happy with this. Now, let's say I'm happy with my phone, you're happy with your phone, everybody's happy with their phones, and then the government comes along to fix it. First with impassioned speeches on the floor of the House and the Senate, and along with a media blitz, we are told that suddenly there's a cell phone crisis and that people can't get cell phones and cell phone service is disastrous, and we find those incidents where it has gone bad and magnify them out of all proportion, and now the government has to come in and fix it, and they say everybody is going to own a cell phone. We're going to make sure that everybody has cell phone coverage, and we're just not going to let these cell phone providers get away with denying people coverage anymore. And so I'm told that I have to have a cell phone. I say, fine, got one. And they tell me, no. You see, all cell phones have to have unlimited data, and yours does not meet that criteria. And I say, well, fine, I'll just go without. But no. You can't do that because it's required by law for you to have a cell phone. And you either have to pay for the service or you pay the fine, which will increase over time, and effectively break the law. And I think, well, I don't want to do that, and I do like having cell phone coverage, so I guess I'd have to get the cell phone that you tell me that I need to have, even though I really don't require all that on a cell phone, and I can't afford it. And you say, that's no problem. We are going to tax those cell phone providers, and we're going to tax the people who manufacture cell phones, and with that tax money, we're going to grant you a subsidy so you can afford the increased prices in cell phone coverage. Okay, now I know what some of you have been screaming for about a minute or so now. I know cell phone coverage isn't the same thing as healthcare. I know this is a convenience and healthcare is a matter of sometimes life and death. So shouldn't the government get involved because it's all the more urgent? And at the risk of sounding callous, I'm going to say no. Because what happens is this. Here's what they do have in common. Both are the results of goods and services. Both are subject to the same market forces. And when I and hundreds of millions of Americans are free to choose our cell phone provider and our cell phone service and even what phone we want, then providers have to compete with each other to provide the best product for the best price, and the prices do come down and the technology gets better. The exact same thing would happen if that was allowed with healthcare. That if you and I were free to choose our insurance plan, if you and I were free to choose our doctors, and free to determine for ourselves what plans we needed and when we wanted to go to the doctor, then those insurance companies that do the best job would be simply rewarded with more customers. And those doctors that do the best services and those companies that produce the best medical supplies would, in the long run, be rewarded for doing the best job for the most reasonable price. And this is how you would begin to see the prices come down to where these things become more affordable and more accessible in better quality to more people. Now, I grew up with a rotary dial telephone, and what this thing can do that's a little bit fatter than, say, a credit card, okay, a fair bit fatter than a credit card, but still it's small, it can give me access to all the information in the world. And that, to me, is an amazing thing. Now think that this is what was affordable to me 9 years ago. This is what's affordable to me now. What would happen if we unleashed those same forces in healthcare and allowed those insurance premiums to become more reasonable, allowed producers to give us healthcare plans that were more along the lines of what we needed for our specific situations, our choosing? Now, some of you will object to that because that's just too chaotic. We don't have people controlling the choices other people are making. And I just want to ask you this. Do you think you're smart enough to choose your own provider? Do you think you are smart enough to negotiate your own insurance and to choose your own insurance provider? Do you think you're smart enough to choose your own doctor? Do you think you're smart enough to know when you need to go to the doctor and when you don't? I think you are. And if you can choose your cell phone, I think you can choose your healthcare provider. And I think if you were given that ability to choose, you would be happier and you would be better off and you would see those prices come down. Hey, I told you a little bit ago, I have a mid-range 5-digit income. You know what happened to my insurance premiums after the implementation of Obamacare? They went up about 400%. And at my income level, that hurts. That intrudes on how much money I bring home. That intrudes on choices. It intrudes on opportunities that I would otherwise have if I didn't have artificially inflated insurance premiums to meet. Now, if the people who impose this on us carved out an exception for themselves, which is what our congressmen did. I mean, yes, they are still technically on Obamacare, but they carved out an exception in this. They made their own exchange, which allows them significantly more freedom and more opportunity to be covered than you and I have, and they exempted themselves from the same rules and regulations that they imposed on everybody else. Why shouldn't you, even if you violently disagree with me right now, why shouldn't you have the same freedom and the same opportunity as your congressman? And speaking of congressmen, hey, congressmen, listen, a lot of you are in real angst right now because now the focus is on you. Now there's a real chance of repealing Obamacare, not these meaningless gestures that you could do when there was no hope of repeal of Obamacare. But now you could actually do it, and you are terrified of what the New York Times is going to say about you, and terrified about what CNN and all the talk show hosts are going to say, and what all the people on the other side of the aisle are going to say. Oh, you want to kill children, says the pro-abortion party. Oh, you want to kill old people, says the pro-euthanasia party. And you're scared. You're terribly scared. So, even if you are scared as a congressman and you're afraid of doing the right thing, let me just ask you this. Haven't we had enough experience with Obamacare to know that that doesn't work? Here's a thought. What do you want to replace it with? What should we replace it with, you ask? How about this? Replace it with freedom. Let us choose.